So our laboratory is very interested in the Lin28 and LET7 pathway in pediatric cancer, specifically in neuroblastoma. And one of the regulators of this pathway is the ornithine decarboxylase gene. The ODC gene has been shown to be very important in especially high-risk neuroblastoma patients, and it results in upregulation of the Lin28. Recently, Lin28 has been shown to be involved in cancer stem cell progression and glycolytic metabolism in many cancers. We've also seen that in neuroblastoma, it portends a very poor prognosis. When this pathway is upregulating, children do very poorly. So we had initially done some studies last year, which were published in November, showing that the DFMO, which is an inhibitor of ornithine decarboxylase, inhibits ODC, results in downregulation of Lin28, upregulation of LET7, as well as downregulation of McGAN, which is important in neuroblastoma, and a reversal of the stem cell phenotype of these cells. We wanted to look further to see then, could we further attack this pathway with multiple different angles, and looking at Bortezomib, which is a proteasome inhibitor that suppresses NF-kappa B. NF-kappa B is also a regulator of Lin28. And so in putting the two together, we wanted to look for synergistic activation, or deactivation actually, of the pathway to get even a greater response in our xenograft models, and then hopefully further in our patients. So we looked in multiple different ways in the laboratory in vitro with the ODC, the DFMO suppressing the ornithine decarboxylase, and the Bortezomib inhibition of the proteasome and decrease of the NF-kappa B. Both result in a decrease in Lin28. We showed that each individually decreases Lin28 in the cells, but together there's an even greater decrease, especially at 72 hours. We showed that using Western blot analysis, looking at Lin28 as well as McGAN inhibition and SOX3 inhibition. It targets all three of those synergistically together. We studied the IC50 of both using cell viability assays and showed that in an isobologram analysis of both, we see significant synergy, especially at low doses of both drugs together. We also looked at how it affects ATP levels within the cells, because glycolytic metabolism and regulation of ATP is very important in our cancer stem cells. We showed that both treating with each individual does decrease the ATP levels per cell, but the combination of the two has a significant further decrease in the ATP per cell levels. So the primary findings were that we saw a decrease in the Lin28 LET7 pathway, a decrease in Lin28, increase in LET7 as well, and in both drugs alone and significantly synergistic in combination with a decrease in ATP per cell. We also did mice xenograft models using the medications and showed that the mice treated with the combination had significantly smaller tumor than either group alone. We've already initiated a clinical trial with DFMO and Velcade. It's a phase 1 clinical trial for children with relapsed refractory neuroblastoma. We are currently on our second dose level. The trial is accruing at 4 centers across the U.S. And once we complete the phase 1 portion, it's written as a phase 1 to go right into a phase 2, and then it'll open at 15 other centers in the U.S. The take home for this is really that combination therapies are really important, especially in aggressive cancers. We know that single agent treatments have a very low response rates and can result in resistance relatively quickly, and that if we can target the same pathway by 2 different mechanisms, it doesn't allow escape of the cells to kind of increase the other pathway to overcome. And then we've seen that in this study, that they're really targeting the pathway by 2 different angles, we can get significant decrease in the tumor size.